On Tuesday, the Permanent Secretary Ministry of Health confirmed to journalists that results from the victim confirmed that the patient was positive of the Ebola Sudan strain. The 24-year-old male victim was from Ngabano village in Madudu sub-county, but there was no certainty how he contracted the disease.
The results were released yesterday evening, and they confirmed Ebola, the Sudan strain. Unfortunately, that morning of 19th, yesterday, the patient who had been confirmed with Ebola passed on, and the current situation is that the body is isolated in the mortuary.
To control the spread of the deadly disease, the ministry has issued measures and standard operating procedures to inform nation response to the disease and stem its spread. The SOPs target mainly health workers, communities, and family members, among other stakeholders that find themselves at the front line in fighting a viral disease that kills 40 to 90% of victims. Some of the SOPs include all health workers, including ADs and cleaners, as well as visitors, to use personal protective equipment and wash or sanitize hands regularly. Scrub or medical suits, not personal clothing, to be worn in patient care areas. Do not touch eye, nose, or mouth after contact with used gloves and gowns. Do not reuse disposable personal protective equipment. Thoroughly clean and decontaminate reusable equipment. All waste generated during decontamination should be treated as infectious waste. Cleaners should wear rubber gloves, impermeable gown, and boots and facial protection while at work. Regularly clean and decontaminate surfaces, including floors. Solid linen should be placed in clearly labeled leak-proof bags or buckets at the site of use. All laboratory sample processing should take place under a safety cabinet or at least a fume cabinet with exhaust ventilation. Limit use of needles and other sharp objects, and never reuse injection or perinatal medical equipment on another patient. Never replace the cap on a used needle or direct the point of a used needle towards any body part.